All right, welcome to today's webinar. We're really glad to have everyone joining us here today. Please feel free to keep introducing yourself in the chat box. It's great to see where people are coming from and how everyone is doing. So just for a couple of logistics about today's webinar, we are recording this webinar and we will post the recording on the MK website for folks to view later. We will also email the slides to you after the webinar, so don't worry, you'll get all the slides in your email just as soon as we're done. Please keep yourself on mute during the webinar. All participants should be muted. And if you have any questions as we're going through the presentation, just feel free to put those in the chat box, and I will be monitoring the chat box throughout the presentation, and we will try to address your questions as they come up, and we'll also have some Q&A time at the end of the presentation from Alicia. If you need any kind of documentation that you've completed this webinar, if you're attending as a professional development activity, you'll get a survey at the end of the webinar, and just make a note of that in the survey. There'll be a place for you to indicate that you need a certificate, and we will email that to you after we get your survey. So hopefully that will cover any questions that folks have. But if you have any other questions, just feel free to put them in the chat box and we will respond as best we can. So you probably already are familiar with the Massachusetts Coalition for Adult Education, MK. We are excited to be hosting this webinar today. If those of you who are newer to our community, we strive to be the voice of adult education here in Massachusetts and to champion the right of all adults to acquire 21st century literacy, English language skills, and numeracy skills, leading to economic prosperity, strong families, and vibrant communities. You have my contact information here on this slide, so you can shoot me a note if you need to get in touch with us, and we'll be happy to respond as soon as we can. So at this point, I am going to just turn our presentation over to our presenter today, Dr. Alicia Modestino from Northeastern University. She's going to be sharing with you the findings of this really exciting report. So I'm going to turn control over to her. Just give me 1 second. And we should be good to go.
All right, thanks Rachel for that introduction, and this is very exciting. I don't think I've ever had control of a webinar before, so I feel very powerful all of a sudden. Whoops, it looks like maybe I don't have, there we go. I'm gonna stick with that and let's see if I can, okay, great. So I am now clicking through, so I do have control, yay. As Rachel mentioned, this is a report that was done in conjunction with the Boston Foundation and the Latino Legacy Fund, and was released in the beginning of February. So some people may have heard a little bit about this, but I'm really pleased to be able to present this to this audience because it was really important to the Boston Foundation and the Latino Legacy Fund to be able to continue the conversation around this work and not have it be a one and done kind of report that gets released. And I think that in the current state of the world where we are at, that all sorts of workforce development training is going to be even more crucial as we come out of this economic induced coma that we're currently in. And so I really welcome any of your questions and some of the discussion at the end about how best to advance the role of ESOL services in supporting workers as we go along. All right, let me just delve right in here. So probably comes as no surprise to people on this call that immigrants account for an ever increasing share of Greater Boston's population. And as such, our economy really depends on the ability of cultivating the skills and talents of these newcomers. And in this report, we address several research questions. One is, does the current landscape of ESOL services meet the needs of the population? That's kind of a basic mechanical question. What challenges do the different types of ESOL programs face in the current environment? And are ESOL programs effective and efficient in achieving outcomes for participants? There we go. And to do this, we use a variety of methods. So we did a landscape analysis that tried to collect as much data as possible on programs. When we first started this, we didn't realize how difficult a lift that would be, as this data doesn't exist in a nice repository somewhere. So you'll see the fruits of our data collection efforts in a few slides. We also conducted some in-depth case studies with actual programs and then collected data from one of those programs to do a return on investment to be able to show what the economic and social returns are to ESOL programs. And then finally, of course, because it's a policy report, we also make some recommendations about how to expand ESOL programs to meet the demand. You'll see that there's a large gap between the demand for these services and the supply. How to better align ESOL services to reflect the needs of workers. In particular, there seems to be greater need for vocational type training than is currently being provided. And then some suggestions around how to improve coordination across the ESOL system, because like all workforce development systems, right, has lots of stakeholders and different players, and improving coordination could really help the system across the board. So just to delve into our landscape analysis and to highlight kind of what area this actually covers, we define Greater Boston as the Boston Foundation's catchment area, which is comprised of the communities that are shown in the map here to the right. And so this is largely Greater Boston communities, but doesn't go probably as further west as maybe everybody who is on this webinar. But just to give you a picture of the landscape that we looked at, in part because the data collection efforts were pretty onerous to be able to get program level data on everything that's operating in this area. And we then compare this to the supply of services provided by the 116 programs that we were able to get data on in the TBF catchment area. And we then are able to identify gaps in services as well as any potential misalignment with what is needed. Since 2010, the majority of Greater Boston's population growth has been fueled by international migration, particularly in Suffolk County, which is most of Boston and Greater Boston. You can see there we've broken down the average estimated rates of components of population change. So this is telling you as the population is growing, what groups are contributing to that and what groups are not contributing to that. And you can see in every instance that international migration is a positive force for population growth in Greater Boston compared to domestic migration, where we typically lose residents each year because we produce lots of wonderful college graduates and they have lots of opportunities all over the country. And then you can also see our natural growth, our natural increase is actually fairly small compared to other parts of the country. And that's because we have an older population and we tend to have fewer children. And so why is this important? Why do I start with this slide? Really to show that immigration is fueling our population growth as well as our labor force growth. And in terms of population, 3 of the last 4 US Census counts have ended with Massachusetts losing a congressional seat after its population grew at a slower pace than in other parts of the country. So in 1980, we had 12 representatives in the US House, now we have 9. That also means less clout in presidential elections, as the state's electoral college vote has dipped from 14 when Ronald Reagan was first elected to 11 in the last 2 national elections. So in terms of thinking about political power, the number of people you have in your state is really important, and immigrants are really contributing to that here. Not only do they contribute to the number of people here, but also they fuel the labor force. So in Boston, the percent of the labor force that's foreign born has doubled from about 15% in 1980 to about 30% in 2014. And as a result, it's become increasingly important that we ensure that our foreign-born population has the necessary skills to assimilate into the region and succeed in the labor market. English skills are really the first rung on the ladder to unlocking lots of beneficial skills, unlocking education, trainment, and employment for foreign-born residents. As of 2017, Greater Boston was home to 320,000 immigrants who were limited English proficient, and most of these, about 75%, were working age. So each year, an additional 18,000 immigrants comes to the Greater Boston area, and of those, about 43%, or about 7,700, are limited English proficient, and that adds to the region's need for ESOL services annually. And then moreover, 3/4 of these are of age 18 to 64, representing just 1 in 10 individuals of working age in Greater Boston. And while not all individuals may choose to participate in the labor force, it's likely that many will do so and would benefit from ESOL services that are both focused on general ESOL education as well as those in the context of a vocation or workforce program. Many of the entry-level occupations that we see require some degree of English proficiency, and those with higher English proficiency requirements typically pay higher incomes. So for example, both office clerks and administrative assistants require a high school degree, but the latter requires a higher level of English and pays 24% more. So ESOL programs provide this direct pathway for immigrants to achieve higher wages without additional education and training, simply by being able to access jobs that require English skills. Although those with less education tend to be more likely to lack English proficiency, LEP individuals span the educational spectrum. And this is true of immigrants in general, and particularly in Greater Boston and Massachusetts, where we have this bifurcated population having a large share of immigrants without a high school degree, but also a large share of immigrants that have a bachelor's or advanced degree as well. And that's because we have lots of graduate programs here. We attract a lot of highly educated foreign individuals. And the extent to which individuals have limited English proficiency is highly correlated with their level of education, but it's not perfectly so, meaning there are some very skilled individuals, even those with a post-secondary education, that have limited English proficiency. So somewhere on the order of 5 to 10% of those individuals. And at the same time, this span of education levels can make it really difficult and challenging to develop ESOL programming, especially when federal funding does not cover those higher proficiency levels. Yet the diversity of the education among the LEP population also increases the payoff to providing those services, so that everyone, whether you're low, middle, high skilled immigrant, can reach their full labor market potential. Compared to the nation, the distribution of languages spoken in Greater Boston is more evenly split across Spanish, Indo-European, and Asian or Pacific Islander languages. Looking at the languages spoken, Massachusetts has more than 200,000 Spanish-speaking residents, making up nearly 40% of LEP individuals in the state. Greater Boston also has a higher concentration of LEP residents speaking Asian and Pacific Islander languages than the state of Massachusetts as a whole, suggesting the need for different types of services across the Commonwealth. Geographically and by language spoken, ESOL programs in Greater Boston are fairly well aligned with the LEP population that needs these services. So that's really a strength and a positive for the state and for the region, where we see the map on the left-hand side is showing you where limited English proficient residents are concentrated in and around Boston. You'll see some concentration right in the city of Boston, but also immediately north and south, and another cluster out near Framingham. And then if you look to the map on the right, that is the distribution by service area of the different programs for which we had data, those 116 programs. And you'll see that there looks like a lot of correlation with where the programs are and where the residents are. There don't really appear to be any immediate white spaces where services are not available. Across the 116 ESOL programs that we identified in Greater Boston, roughly 11,600 students are served annually, or only 1 out of every 20 working age LEP individuals. So in other words, it would take just over 20 years to meet the existing demand for ESOL services, let alone keep pace with the annual growth in the limited English proficient population, which expands every year due to continued immigration. So remember, there are 7,700 individuals who are migrating into the area who are LEP proficient. And so that just adds to the demand each year. And as you can see from the chart, both public and nonprofit programs vary considerably in size, serving anywhere from fewer than 90 people per year to well over twice that, with many constrained by a lack of funding. Both public and nonprofit programs have to braid together multiple funding sources to be able to provide services. And this really highlights the inefficiency of the funding structure. This isn't anything that's unique to the ESOL sector. We find this across all workforce development programs, but it definitely adds to the level of complexity, especially when you're trying to serve the needs of different populations and have that fluctuate over time. Funding for the majority of ESOL programs in Massachusetts comes from a mix of federal and state sources. The primary federal source, of course, is Title II of the Workforce Innovation and Opportunity Act. Title II is the Adult Education and Family Literacy Act, which I'm sure everybody on this webinar probably knows more about than I do. Administered through DESE, and among the programs for which we have data, funding through DESE is the most common, followed by a mix of unspecified grants and support, individual donations, and gifts. Not surprisingly, most of the DESE money goes to public or government organizations. Nonprofit organizations have a fairly substantial portion that's covered by this other, which often means small grants. and have to braid together support from many different sources. That can lead to a lot of uncertainty year to year about how many people can be served and in what way. The for-profit programs are obviously funded by tuition. Okay, so that gives you kind of a flyover of our landscape analysis. Now I want to delve into our qualitative case studies a little bit. Here we're going to present some findings from an online survey that we did, as well as in-depth interviews conducted with program directors and managers for 3 types of programs: community-based programs, vocational programs, and incumbent worker programs. One thing to note that despite their differences, at the core of each program lies this conviction that ESOL is a passport to better integration into US society and economic self-sufficiency. Everybody felt very passionate about the work, about their mission. In the community-based program, there's more of a focus on life skills and functions of daily life, such as going to the doctor, getting a job, shopping, public transportation. The instruction is mostly focused on developing general English language skills, listening, speaking, reading, and writing. It's often taught by paid teachers and volunteers, some combination of the two. And they also provide other services like assistance with immigration paperwork, residence and citizenship, other documents that could be needed to secure social benefits. Vocational programs typically have a slightly different mission, where they're really viewing career preparation and support for job placement and advancement as a key part of their services. There's a focus on skills such as resume building, job search techniques, preparing for an interview, all of the things you would imagine that would go along with workforce development. They typically are taught by paid teachers. They don't rely as much on volunteers. And job placement services are really a big part of their other services here, as well as things like housing assistance and other public benefit assistance. And then finally, among the incumbent programs, they're really focused. So these are incumbent worker programs, are programs that are housed within an employer typically, and they build English language skills, as well as other foundational skills for employees, often delivered on site, in some cases during paid work time. Their class materials are somewhat customized based on the competencies that they're looking to achieve. And they are typically implemented by an ESOL provider under contract for the employer. And some of the other services that are provided are things like training, internships, career and academic counseling, and other on-site pre-college courses. Oops, sorry about that. So we looked a little bit about what were the strengths, weaknesses, opportunities, and threats that programs identified to see how much variation there was across and whether or not there were common themes that we could build on. In terms of strengths, pretty much across the board, they all felt that the quality of the teaching staff was really an important strength that they all had. There was open access to all for the community-based programs. They felt that was a huge strength. One of them said, I have the best teachers in the world, you know, they're so good, they work so hard, they go the extra mile. The vocational programs also valued their teaching staff. They really felt like they had tailored their programs to the demands of the workplace. One interviewee said, when refugees arrive here, they have very little English. We create a resume for them, we prep them, and we also work with the employer. Like if you need 8 people who can cut fish at night, these are your people. And then the incumbent worker programs really were focused on providing classes that help their employees improve skills in areas that are in high demand. And they felt that that was really a strength to be able to give people an opportunity to move up within the organization. In terms of weaknesses, in the community-based programs, they really felt like a lack of transportation and childcare was an issue. There was also some high turnover among their students and staff. One community-based program said at certain times, buses stop running, then you can't get home. We've lost some students because of that. In fact, the first question we ask when they come in is, where do you live? In the vocational space, funding was often a constraint because they have to limit their funding to those who are eligible to work. And then also with some of the requirements among DESE, if there's funding from DESE, then they're required to fill seats during the semester to make sure that all their program slots are filled, and they felt that was very difficult. One vocational program said, if a student leaves for college or a job training program, that means that we have to fill that slot with another student. And that has been really, really hard because for a student that comes in the middle of the semester, it can be challenging. For teachers, it is very disruptive to get a new student in week 8. And then the incumbent worker programs faced some constraints in terms of the workplace with being able to take classes either during work time or if employees could take them on their own time. So for example, in the hospital sector, it's really hard to be able to carve out time for somebody to take classes on their shift because it's all shift work. And also the firms are not eligible for funding through the state's workforce training fund, especially the larger firms that self-insure for UI benefits are not eligible to take advantage of that funding source. In terms of opportunities, the community-based programs really saw the need for more career advisors, for volunteers that could be available for college advising. One program said, we also need more advisors to help the students. We have one advisor now, and he is an adjunct, but he works during the day and night. When we have on a given night, maybe 35 students. In terms of the vocational programs, they really felt that the opportunities were having strong enrollment with long wait lists, suggest that there was unmet demand. So that was an opportunity, right, to be able to expand. And I know a lot of programs were looking to do that before the economic disruption from COVID-19. They really felt that the services they were providing were helping to increase productivity and helping to get their clients promoted. One vocational program said, so we always have a rolling waiting list for some of our classes. We almost always can fill a slot tomorrow. Another one said, my supervisor said that she can tell enormous differences between when I started the high school program and now in terms of my written communication. So the return on investment and the value of the work that people are getting and their promotions is a totally untapped area. So they really felt like more of this work could be done. In terms of the incumbent worker programs, they really see opportunities in developing partnerships with peer employers. So we know that happens in the healthcare sector between Beth Israel and Children's Hospital that have combined their program so that they can get to scale and increase the number of ESOL levels and also the times that they can offer classes. Oops, sorry. In terms of the threats that they saw, the current funding structures been an issue that people have talked about. One program said, we used to care about registration to vote, getting your citizenship, participating in activities with your child at school. We used to track all those things. Sadly, over time, we stopped doing that as nobody seemed to care about those things. So there seems to be an issue around very narrow metrics that only measure education and employment outcomes and not being compensated for some of these other things that programs feel are very valuable for their clients. The vocational programs talked a lot about space constraints, the struggle to retain high quality teachers, again, having to teach to a test rather than teaching some of the skills they feel like people need, having to braid together funding. One program said working in a nonprofit means that we have to do a constant fundraising and organize a gala. We have a team of people involved in ways to raise money. It's a nonstop thing. This is the most challenging part of our work. So you really hear a lot about having to spend time on that when they'd rather be teaching. And then for the incumbent worker programs, lack of tracking and data on student progress was somewhat of an issue. So they don't have the same reporting requirements as other programs do in the community-based and the vocational space. And so they would really like to see more tracking to be able to know what they're getting out of these programs. And then not all employees who need ESOL can take it due to family responsibilities. So we took all of this knowledge that we learned from the case studies, and then we also tried to build a model where we could think about what are the economic and social returns on investment for ESOL programs in Greater Boston. And one of the reasons why we were charged with this from the Boston Foundation and the Latino Legacy Fund was they felt that the moral argument and the social case had already been made, but if we really wanted to get more investment in the sector, we really had to make the economic argument for these services. And frankly, it's not that hard to do. So while providing ESOL services to immigrants is obviously a laudable goal in and of itself, the Commonwealth has limited resources, and so it seems reasonable to ask what the societal return might be. We started with thinking about what are the goals of the Adult Education and Family Literacy Act. They're very broad, and they include both economic as well as social objectives. So the economic objectives for programs that are receiving federal funding through DESE are to demonstrate improvements in skill levels, which I'm sure many people on this webinar are very familiar with, but also placement, retention, completion of post-secondary education, training, unsubsidized employment or career advancement, and then also receipt of a secondary school diploma or its recognized equivalent. So we've moved beyond just thinking about skill levels to also thinking about how to measure these other types of objectives. In terms of the social objectives, There's also an expectation that ESOL instruction is supposed to provide other types of things like becoming full partners in the educational development of children, improving economic opportunities for your family, understanding the rights and responsibilities of citizenship. It's not surprising that if you look at the data, difficulty speaking English can adversely affect one's ability to obtain a job, maintain employment, pursue an upward career trajectory, and earn a living wage. So looking at this data, this shows you on the spectrum here from speaking only English, so those are native speakers, to those who are speaking another language, and then also by the ability to speak English very well down to not well at all, what are the trajectories of individuals in terms of their labor force, whether or not they work full time, and then what are their annual earnings. And you can see in every case that obviously individuals that have better English proficiency are more likely to be participating in the labor market. They are more likely to be working full time. And then in terms of wages, those who spoke only English earned $5,600 more per year than people who spoke another language. Although we can narrow that gap quite a bit if you look at on the bottom there in those green bars, comparing those who speak only English to those who speak English very well, right? That difference right there is only $900. And so really that's showing you the added advantage of ESOL training. But there's considerable variation among programs with performance ranging from meeting 49% to up to 130% of these measurable skill gains that are targeted by DESE. So even though we know that ESOL training is very effective, it doesn't necessarily always get delivered across the same populations and in the same way. And the state's investment per student has actually increased over time, as well as seeing these changes in terms of proficiency. Oops, sorry. So roughly a third of participants in DESE-funded programs and 2/3 of participants in the vocational programs were employed after exiting the program. And so that shows in terms of the labor markets that actually there's fairly high return in terms of ESOL programs. Despite 75% of the labor force being of working age, less than 10% of programs are offering vocational workplace services, suggesting there's some misalignment between supply and demand. So here is looking across the different programs that we were able to target in terms of our survey. And although general ESOL programs offer some job-related services, they are very loosely integrated, and the intensity and level of integration appears to vary substantially. So for example, some programs cover careers as a single topic or a unit, while others offer a general overview to prepare students for searching for jobs or training. More contextualized services are typically available only to students at higher proficiency levels. And so that's why we see there's some gap in terms of the types of services that are provided if 75% of the population is of working age, but only 10% are really offering something that's vocational or workplace-based. And then finally, when we put all of this together, when we look at the employment and wage gains, vocational ESOL programs break even within 5 years. So it's a very narrow view of the cost versus the benefits. But even with that very narrow view, 5 years is tremendously excellent performance for a workforce development program. And so that's only counting, if you look at this chart here, on the left-hand side, the employment gain from participants who exit the program and gain employment after they exit, as well as the wage gain of those participants as well. If we also add in the health insurance gain right there, so that's 112 participants who also gained health insurance, then we would see a break-even time of just 18 months. So to explain a little bit better what this figure represents, this is data from one of the programs that tracks outcomes very meticulously before and after being in the program. And so we could actually measure whether or not individuals were able to get a job after exiting the program if they didn't have one before, as well as whether or not they observed any wage gain if they had been previously employed. And so on that left-hand side, the average cost per participant was $2,500. The total cost over 700 participants added up to 1.75 million. after the program, 268 participants gained employment, and they had average earnings of about $20,300. Another 362 participants already had a job when they had entered the program, but they also saw a wage earnings increase on average of $5,100. And then again, another 112 gained health insurance. And so when we add up all of those gains or those benefits relative to the cost of the program, it would break even within 18 months, which is pretty much a no-brainer from a labor economic standpoint. If we then add in the state taxes paid and the avoided Medicaid costs, as well as the additional income that individuals receive. So it's not like they're working for free. They're actually producing restaurant meals, or they're cleaning hotel rooms. They're actually providing value. If we add in that benefit to their families as well, then this breaks even as soon as they exit the program. And then finally, just thinking about the opportunities and recommendations for investment, and then I'll wrap up and we can have a little bit of a Q&A. Some of the things that we thought about were things like expanding ESOL program capacity to meet demand. That seems like a really obvious place to start. As I said, it would take 20 years to serve the number of people who are already waiting for ESOL services. So we really need to reduce the gap between the capacity of the system and the need for ESOL services. It's not like we're even close to meeting that demand. And then also improving the working conditions to reduce turnover among ESOL teachers. So a lot of programs talked about how they have these fabulous teachers, but because they have many other opportunities and the pay and the scheduling is not as beneficial as in other occupations, they tend to lose their staff to other places. Better align the ESOL services to reflect the needs of workers. So providing student supports, we heard about issues around transportation and childcare to try to increase the continuous participation in ESOL programs. So actually Massachusetts does better than some other states in terms of ensuring continuous participation, which seems to be an important factor towards making these measurable skill goals, but we still could make improvements there. And then growing the number of vocational and workplace ESOL programs. It really became apparent to us that there's definitely a misalignment between what participants are particularly looking for in terms of having English instruction that can lead to a job or lead to a better job, and not having very many programs that offer those services and have those partnerships with employers that can help place participants afterwards. And then finally, improving coordination across the system, connecting some of the fragmented parts of the system in terms of service providers. This actually seemed to be more of a problem to the programs we talked about that were in and near Boston, where you have many providers, and maybe they are overlapping in some ways, whereas out in the western part of the state, it seemed to be much more coordinated between the community colleges, the workforce development programs, and the nonprofits. And then finally, improving the data collection and reporting, because I certainly, as a researcher, didn't realize what a challenge it would be to try to collect some data, even on how programs are running. But in addition to the measurable skill gains that have to get reported to DESE, what are the costs and what are the benefits? That's really been a big unknown until recently, and I know more of that capacity is coming online. But if we really want to be able to measure this and make the case that we have this great economic return to these services, then we need to be able to document it better. And that's all I had in terms of my talk. I'm happy to take any questions and answers. I know I've seen the chat filling up. So perhaps we can have Rachel moderate, and I'm happy to answer any questions.
Okay, great. Let's see. Continue. So just want to encourage folks to continue to put questions in the chat box. I'm actually not seeing questions here. Do you see questions in the chat box, Alicia, that you want to respond to?
Let's see. I see lots of people saying hi.
Okay, great. So yeah, folks, if you want to put your, go ahead and put your, any questions that you have in the chat box, and we will get to those. I'm just gonna try to.
One question that I've gotten in the past, which might be relevant while we're waiting for the chat to kind of populate itself, was, and and something I didn't get to talk about in the presentation, because there's many details in the report. So I encourage you to go to the Boston Foundation and find the 60-page or so tome that we did produce, because there's lots of useful data in there, but hard to cover that in 35 minutes. But one of the things I got asked about a lot was online instruction, which suddenly has become much more relevant than it was only a few months ago. And there's really not very many programs that operate online. And the little data that we had on programs that operated online seemed to indicate that folks don't usually persist in those programs. They don't, there's not as much continuous enrollment. The measurable skill gains are lower. And so a lot of programs have said, well, we don't really think that this is a great way to deliver services. We really think it should be in person, like we do with lots of other types of instruction. But what I've been hearing from programs since then is that, you know, the crisis is the mother of invention. And so we've seen lots of programs, and particularly the incumbent worker programs, that really wanted their employees to be able to continue to pursue ESOL services, even if they are furloughed right now or working a limited schedule. We're seeing a lot more of the instruction moving online. And I really wonder if that is going to be a game changer going forward, because of the costs in terms of finding space and hiring a certain number of teachers, and whether or not online is going to help us reduce those costs. And I guess we're doing this natural experiment right now to see how effective it is, and maybe developing some best practices about how to do it the most effective way.
Great. I do see a question here about whether learners were asked about their access to technology, and whether, you know, whether the learners were spending time doing learning online. So that definitely seems like a question that will continue to grow, I think, for the sector.
Yeah, we didn't have data, like we didn't survey any participants of programs, so we don't have data on their access to technology. We were only had access to the data from DESE that showed for online participants kind of what their measurable skill gains were and whether or not they were continuously enrolled. But, you know, access is certainly a big challenge. One thing that's come up is we just recently saw a massive deployment of Chromebooks through BPS to lots of households that didn't have them before. And not that every immigrant household seeking ESOL services is going to have a child in BPS, but you know, there could be opportunities to piggyback off of some of the technology that has been deployed in the crisis.
Mm-hmm. Great. I see a couple questions about sort of the types of programs, whether you did the ROI calculation in the regular, the vocational, or the incumbent worker programs, and whether there's variation across those types of programs. And I was also wondering about whether there was some exploration of how partnership between those types of programs might help fill some of those gaps.
Yeah, I wish we could have done this calculation by program type. That was what we initially set out to do when we pitched this project to the Boston Foundation. And then we got into collecting data, and it's just not there. Most programs only collect the data that DESE wants them to collect, in part because they are under-resourced as it is. And so they don't necessarily have the capacity to be collecting data and measuring pre and post what participants are experiencing. So they pretty much only measure at the end of the program whether or not somebody gained employment, or if they had a wage gain, or if they entered a post-secondary program. And then they do keep up with their clients a lot after that, especially if they're in a college program. They offer them lots of advising and help with their writing and coursework. But we don't know much about the pre-situation, which makes it hard to then measure the gain from being in the program, right? So if you had a job before and you had a job after, then what do we know about how impactful that was if we don't know what your wages were before and after? And so really, it was only one of the vocational programs that measures their data in this way. And if I were to speculate, I would say that to some extent, the program that we studied, because they're the only one collecting that data, is probably something that we could think of a little bit of as a gold standard in terms of providing those types of vocational based services. But I do think that it at least demonstrates what is possible in terms of a return, even if it's not typical across the entire sector. The other question is a really great one, and I think one that has time, is that if you're going to expect other programs to be more vocationally focused or have more of a vocational bent to them, especially general programs, that you're going to need to offer them some supports in terms of those employer partnerships. Those things don't happen overnight. They take time and resources to develop and to cultivate and to maintain. And so it's probably the best way or the most effective way initially to try to cultivate that across more programs and across more iterations is to be able to form those partnerships between the vocational programs and the general programs. And indeed, you know, one of our programs that is vocationally based, they also do operate a general ESOL program that's funded by DESE, right? So they already have that sort of natural partnership going, and you could imagine more of that happening across the sector, especially if it were incentivized by the state, if it were something that the state put some dollars towards.
Great. Also seeing some questions here around if there's more information about how this work might lead to more funding for the different types of programs. And, you know, I would ask too, you know, as advocates, knowing that this is a complicated funding structure, you know, where should we be looking for funding for these programs to come from?
Yeah, we did see some increase in funding, mostly because of different groups coming together to advocate for that. And so the state has increased the pie over the last year or so. They've earmarked more towards vocational training, which is useful. I think, you know, this report in part was to help make the case that there is a return to this investment, right? That there is an economic case to be made. So for example, when we tally up all the employment and wage gains and what the taxes are going to be paid off of that by the individuals, right? It'll break even in 5 years, which sounds like a long time for an investment from a business perspective, but from a state perspective, it's actually fairly good. And then if you add in the healthcare benefits on top of it, right, we're talking about a return in 18 months. And so that kind of argument helps make the case for greater investment if you're going to get that money back as a state within 18 months or even sooner, because really those individuals, when they become employed, they're also doing work. And so before COVID-19, we really had a shortage in terms of workers and being able to fill jobs in hotels and in restaurants and other types of places, lots of entry-level jobs that are now frontline types of jobs during the crisis. And so, when you're in a very tight labor market, it's also a much easier case to be made for increasing that funding.
Yeah, absolutely. And I do see a question here about, some of the job sectors that were mentioned were things like restaurant, retail, housekeeping, which of course have been hit very hard now. Were there other, did you also look at how those vocational programs were aligned to other types of industries?
Yeah, so actually, I mean, healthcare is, one place where most of the incumbent worker programs, so the programs that are based in employers, at employer sites are mostly with the hospitals in the healthcare sector. And so even though right now we have a funny thing going on in healthcare where half of the healthcare sector is furloughed because they're not emergency services, which is a little bit of an issue. And hopefully that's one of the first things we reopen, in part for people's mental and physical health, but also because we really don't want these small practices to be going out of business. They're really essential. But then we have another sector in healthcare, which is, going at full force and could use all hands on deck, right? So the hospitals, thinking about certified nursing assistants, respiratory therapists, those are all middle skilled jobs, right? You don't need an MD to be a CNA or a respiratory therapist. Those are all jobs that people can be trained for. But again, English is incredibly important in that sector to be able to communicate effectively, but even more so are bilingual individuals. So that's another interesting trend, is that it's not just that people need to learn English in order to assimilate into the US, but there's an incredible demand, especially in healthcare and some other key sectors, for people who are bilingual, right? To be able to speak to the patient and then also speak to the doctor who often, is not bilingual, and be able to make those connections. And so healthcare, I think, is, obviously going to be a sector that we will see return to growth quite quickly. And so we don't have to lay it all at the doorstep of the restaurants and the hotels and the hospitality industry that's really been devastated as of late.
Sure. I'm seeing a question here about the regional aspect of the report, and I was wondering that as well. I know you mentioned that there weren't, in the region that you looked at, there were really no gaps, not too many gaps between where services are and where people are. I'm wondering if that you expect that to be true elsewhere in the state. I see a question here specifically about the Worcester area. if there's any advice about areas you wanted to explore, didn't have a chance to, or how we might extrapolate some of this to the rest of the state beyond Greater Boston.
Yeah, we mostly focused on Greater Boston for two reasons. One was the Boston Foundation has a particular area of interest that they're usually looking to make policy in. And then the other was just the sheer need in terms of collecting data. So when we first started this project, we thought that'd be fairly easy to find out what are the programs in operation, how many people they serve, what are their costs, what's their structure look like. But there are so many small community-based programs at libraries that are run by volunteers and things like that, that it was a much bigger data undertaking than we expected. And so we ended up sort of agreeing with TBF that we would focus on the Greater Boston area. But we did talk to one program out in Western Massachusetts and more out towards the Springfield area. And while I'm sure they have gaps in terms of geography, just because everything is more spread out in the western part of the state, I was really impressed with the level of coordination that they had between the community colleges, the nonprofit organizations, even the secondary schools, and the employers, and with the workforce development board that's out there, where it seemed much more of a seamless coordination and handoff than what we find in Boston, where there's many players in all of those different segments. And so it's a little bit of a crowded field and a little bit harder to coordinate. So I would say one of the strengths, at least that I can recognize right now in Western Mass, is having that coordination, maybe out of necessity because there aren't as many providers out there. Although, I wouldn't say that they probably have, as saturated in terms of geography as we do in Greater Boston.
Mm-hmm. Great. And I was wondering too, if there were, you had gone through some of the savings factors or the income positive components of the data that you looked at. I'm wondering if there are other, besides wages and taxes and health care and health insurance and Medicare and things like that, were there other sort of economic factors that you didn't quite get into the data yet, but you suspect might also be impacted by this work?
Yeah, so there's, a not insubstantial number of participants who do go on to get their post-secondary degree, whether it's a community college degree or a four-year degree. So in the data we looked at, I think it was 30 participants over the year from the DESE data had gotten a post-secondary degree. And again, that puts you on a completely different trajectory in terms of earnings, and so has a very distinct return on investment. And like I said at the beginning of the presentation, ESOL services are really the first rung to be able to access these other human capital investments, whether it's going to a community college or a four-year college or a workforce training program, or just being able to advance in your own workplace and take advantage of the training that's there. So we weren't able to exactly capture what that was in the return because we didn't have that kind of data with the one program that we looked at. And then there's a whole host of other factors of why we think that this kind of instruction is beneficial anyway. And those are some of those social focuses that we saw from the Literacy Act in terms of being able to participate in your children's education, right? If your child's homework is all in English, or if all the communication from the school is in English, or if the IEP meeting is largely going to be conducted in English, right? This is going to help you make sure that your kids get ahead, or even just being a more informed citizen, right? And being able to participate, being able to vote, being able to take advantage of all sorts of social services. So right now, right, we've expanded unemployment insurance benefits, which is really going to be a lifeline for workers in the hotel and restaurant industry. And those individuals are able to apply for UI benefits if they have legal status, right? But in order to know that and know how to apply for that, knowing English is helpful, even though the website is in other languages. But, it's, again, just helpful in terms of being able to access those kinds of services.
Absolutely. All right, great. I think we're getting towards the end of our time, so I'm going to have us move on from the questions, but thank you for sharing all of that information. Please, everyone join me in thanking Dr. Modestino for sharing this wonderful report. Certainly a lot has changed since the report came out, so I know there'll be a lot more thinking to come, and we'll be glad to have you back for future conversations about this work and what it means in our sort of new environment. I do want to
Great, thanks for
share,
hosting me.
yeah. I do want to share with folks that we have additional webinars coming up that you can register for. We have one next week on the Massachusetts Literacy Hotline and some other resources that you can get that way through related to COVID. And so the hotline folks will be sharing what the resources are and how you can access those, how learners can access those resources. We have a great one coming up on teacher self-care, which is even more important now than ever. And later in May, we'll have another session on some blended and distance learning tools and systems that programs can use to keep their work going online. So please register if you haven't yet for those webinars. We're looking forward to sharing that information with you all. We will be sending a survey out after the webinar along with the slides. And so we ask for your feedback on how the survey went. On how the webinar went. It's a very short survey. This was the first one, so this will help us improve future webinars. And as I said before, if you need a certificate or some kind of documentation that you completed the webinar, you'll just enter your email in the survey at the right spot and we will send you a certificate for that. You can stay connected to MK and our work in lots of different ways. You can follow us on Twitter, like us on Facebook, sign up for our newsletter and our action alerts if you haven't already. And there's also ways to join MK as a member. We're hoping that some folks will help support our work going forward, especially as we focus on the budget work coming up. And you can join us as a member and learn more about what that looks like. Again, here's my contact information. I'm Rachel Gwaltney. I'm the director of MK, and my email address is here if you need to get in touch with us. Be glad to hear from you and what you're working on, what you need. I wanted to let you all know that even though we did not have an opportunity to have our network conference this year, unfortunately, many of you have attended network with us in the past. Every year, the conference brings together over 500 teachers, tutors, counselors, administrators, and advocates to strengthen the practice of adult education in Massachusetts and to celebrate the passion, the intelligence, and the perseverance of this community that's so vital to our future. So even though we had to cancel this year's conference, and we are bringing some of that content to you through this webinar series, we hope that we'll be together next year in person. So please save the date here, March 26th next year, for our 2021 conference. So thank you again, Alicia, for sharing that great report. Thanks to all of you for spending some time with us this afternoon. Stay safe, be well, stay in touch with us, and we look forward to connecting with you soon. Thanks very much.